Dr. Kwabena Opoku Edusei was speaking to Joy News on the sidelines of a workshop organized by the Parliamentary Select Committee on Health to tackle the recent cholera outbreak in Ghana.
In the next 10 years, we need 30,000 houses. The next 10 years, we need to construct our gutters. In the next so many years, we need to distill all our gutters. We need to build the schools to this. As of today, unfortunately, most of these policies are parties' political manifestos, but you can't hold them to it. So if as a country, we have a national policy which spells out everything, any party can come, you must adopt and continue that policy, because it's an enforcement on you as a leader, as a political group, to make sure that the national agenda is carried.
From the Greater Accra region, where the cholera outbreak began, the epidemic has spread to 6 other regions in the country. And President of the Medical Association believes government must walk the talk and firm up efforts at tackling it.
Today, I read that food sellers or vendors must be stopped. The issue is that who should stop them? In the country that we always talk and talk and talk and no action. If we think that we need to stop people who sell food at unapproved areas, at areas where cholera outbreak has taken place, we stop them. Somebody take that decision and stop them. Not that everyone say they should be stopped. Who should stop them? This is a matter of local government. The local government must stop them. This is a matter of Ministry of Health. They must stop them. This is a matter of from the presidency or Ministry of whoever needs to stop them must stop them.
Ranking member of the Parliamentary Select Committee on Health, Dr. Richard Anane, meanwhile says Ghana can only eradicate cholera if the nation works together with its neighbors.
Before you use the word eradication, you must be sure that you are doing it in consonance with other countries around you. If you do it only to your country, it may be really difficult. So let us hope that by this meeting, it will be taken up even at the WAHO level, and then we all together as a sub-region, just like it was done for Ebola. Because yes, we did call for a meeting of the sub-regional ministers of health, and they have done it, and it's happening together. So we think that in this particular instance too, we may have to tackle it together.
According to Deputy Minister of Health, Dr. Victor Bampo, the World Health Organization has introduced 2 new vaccines to fight cholera. He also indicated a team from the WHO was currently in the country to conduct a risk assessment to ascertain if Ghana qualifies to use the oral cholera vaccine. He said the Health Ministry is making efforts to expand the various health facilities so they can handle more cholera cases in order to save more lives.
We need to expand the facilities, and we are also talking, amongst ourselves to see how very quickly we can provide more facilities. As you heard, some people are lying on benches and so on. That's not the way it should be, and we'll make sure that we provide what it takes to treat people properly and make sure that they have their dignity, and get cured from cholera.
Officials are expected to issue a communique on Friday on measures government must adopt to deal with the cholera menace.